Good afternoon, everyone, and welcome to the official opening press conference of the 20th International AIDS Conference. My name is Chris Byrer, and I'm the President-elect of the International AIDS Society. As we all know, it has been a long and very emotional 48 hours, but I think that I can speak for all of my colleagues here when I say that we are ready and determined to make this conference the huge success it deserves to be. We have an outstanding program, one that we are confident will produce global headlines in the days to come. But of course, before we begin the hard work that will begin this evening at the opening session, we want to pay tribute at that opening session at 7 p.m. this evening to the colleagues and friends that we have all lost on MH Flight 17. I understand you were briefed this morning on the remembrance details, but for those of you who were not present, here they are briefly. There will be a 1-minute global moment of remembrance, which will be held in their honor with 11 former, present, and future presidents of the International AIDS Society on stage together with representatives from the World Health Organization, from AIDS Fund, from Stop AIDS Now, the Female Health Company, and the Amsterdam Institute for Global Health and Development, and members of the Dutch HIV research community. A letter of condolence and support will also be read out by Mr. Lambert Grins, the Dutch Ambassador for Sexual and Reproductive Health and Rights and HIV/AIDS. Condolence books are also circulating on site at the conference for the duration of the event. On Tuesday, July 22nd at 1600 AEST, there will be a candlelight vigil held at Federation Square in the center of Melbourne. We will now hear from 6 speakers who will briefly outline what they will say at tonight's session, and then we will have some opportunity for questions. We would like you to identify yourself if you have a question and your media outlet, and please do keep your questions as brief as you can. It is now my distinct honor and pleasure to introduce Françoise Barré-Sinoussi, the Director of the Regulation of Retroviral Infections Unit at Institut Pasteur in Paris, and the current President of the International AIDS Society and the International Conference Chair for AIDS 2014. Françoise.
Thank you very much, Chris. Just a few words about the topic itself, this conference in Melbourne. Since we met in 2012 in Washington, D.C., really it has been progresses in science, both in the field of HIV vaccine and in the field of cure. It has been also some disappointment, including recently the last data with the Mississippi baby, but we are there really to make, as usual, the last update on the progress in science, and also to exchange about the priority for the future. I like to say that Melbourne will be certainly a place where we will speak about the revolution in the field of treatment of HCV. It's true that we don't have a cure for HIV, but we have now a cure for HCV, and this will be a very important point at the conference. We will certainly also mention implementation to continue to have access to make progress in access to treatment to all. And we also will make pressure on government concerning new repressive legislation that they are implementing in different countries in the world, and that is really not acceptable. This is our responsibility to make pressure on those governments.
Next, I'd like to introduce Michel Sidibé, the Executive Director of UNAIDS, the Joint United Nations AIDS Program, and Undersecretary General of the United Nations. As the head of UNAIDS, Michel has led the organization's contribution to regional and country responses, as well as its efforts in global policies, evidence, and monitoring and evaluation. Michel.
Thank you very much. I join my colleagues in expressing our condolences. I think I am fully agreeing with my colleague and friend Françoise, when she's saying that since the last conference in Washington, there have been extraordinary progress. We estimate that by July, 14 million people had access to treatment. More has been done, and that is very important. More has been done in the last 3 years than in the last 25 years. I repeat, we quickened the pace. We changed completely the trajectory of implementation. During the last 3 years, we have been able to put 5.6 million more people on treatment. Who could have imagined that one? But we are seeing also new challenges, and that is very important, new generation of challenges. Half of the people living with, even more, living with HIV don't know their status. And that is very important. For the first time, we have a proper data, 19 million people out of 35 million people don't know their status, HIV status. Half because of stigma, discrimination, because of exclusion, because of criminal laws, because of people are hiding themselves and people are scared to use services. Sex workers, for example, are 13 times more likely to be living with HIV. And many fear carrying even condoms because they could be arrested. We know, for example, in Africa, young women account for 1 in 4 new HIV infection, 25%. Prisoners can be up to 50 times more likely to become infected with HIV. If the people living with HIV don't find out their status, they will die. And that's why we are pushing to make sure that we'll put resources where new infection occur and where people are dying. And we know today that in 15 countries, we have a 75% of a new infection occurring. 75% of death is happening in only 15 countries. So the objective for us is to make sure that we have a return on investment for using our resources where epidemic is happening. And to do that one, we will call, of course, the world for new target, a bold, ambitious target, to make sure that we can have 90% of the people tested by 2020, 90% of those people on treatment, and 90% with undetectable viral load. And we believe by doing that and achieving that by 2020, we can be able to really control the epidemic by 2030. And we think when we talk about controlling the epidemic, ending AIDS, it means that it will not be anymore a public health threat for any of us, any countries or individual or village. And thank you very much.
Our next speaker is Ayu Oktaryani from Indonesia, who is a youth representative and speaking from the Youth League. Ayu?
Thank you. Hello, everyone. On behalf of the community, I'm very proud to be here to join this big conference, AIDS Melbourne 2014. Not so many people, especially people living with HIV, can join with such event. So I just want to make sure that all activists, all people living with HIV, all people who engage in this part of the conference bring back something to their country, to their city. Do something. Don't just speak so loud or just act like it's a big conference. I will speak on behalf of the community in the opening with other 20 people living with HIV from Asia and Pacific. We're gonna using our beautiful traditional dress from many countries. You can see at the stage at the opening. And I will just send my resume. So I will share about what's the challenge for me as a woman who are living with HIV, for facing life with HIV, and how we can together hand in hand work for a better world for people living with HIV. And we really hope that people living with HIV should treat with respect and dignity as human beings. Thank you very much.
Our next speaker is Brent Allen, who is the Executive Officer of Living Positive Victoria and the current local co-chair for the Community Program for AIDS 2014. Brent has lived with HIV for over 15 years and has more than 25 years' experience working in social justice and human rights, public health policy, health promotion and education, and community development both in Australia and overseas. Brent?
My pleasure to welcome you to Melbourne and to acknowledge the traditional owners of the land we're meeting on, the Kulin Nation, pay my respects to their elders, both past and present, and respect their enduring custodialship of the land we're about to celebrate on. I also would like to acknowledge people living with HIV as central and vital to the control of the epidemic, both locally and around the world. I would like to encourage everyone, including yourselves, to promote what I believe to be an outstanding document, the Melbourne Declaration, which calls to an end to stigma and discrimination, whether it be on the basis of your HIV status, your sexuality, your gender, or your age. For all my friends who are my family from around the world, who are injection drug users, sex workers, people living with HIV, gay men, from transgendered communities, I welcome you to Melbourne. I encourage you to learn, to listen, and to reflect upon what we are about to embark upon. Welcome.
Thank you. It's now my pleasure to introduce Professor Sharon Lewin. Sharon is an Australian infectious disease physician and scientist. She's the director of the Infectious Diseases Unit at the Alfred Hospital, professor of medicine at Monash, and co-head of the Centre for Biomedical Research at Melbourne's Burnet Institute. Professor Lewin is a former president of the Australian Society for HIV Medicine, the peak Australian organization representing the medical and health sector in HIV, viral hepatitis, and related areas. And if that doesn't sound like enough for one person to do, she has also served wonderfully as the local co-chair for AIDS 2014. Sharon.
Thank you. I would like to start by paying my respects and condolences to the friends and families of all who died on MH17, and of course including our close colleagues who are on their way to attend this conference. This will be the first time this conference has come to Australia, and as an Australian I'm incredibly proud of the response we've had to HIV now over many years. It's been characterised by a bipartisan government approach and support, constant community partnership with all key affected populations, and investment in science and research from the beginning. As a result of those three strategies, Australia does have one of the lowest rates of HIV in the world. However, we are in a region which is nowhere near as lucky as we are, and I will make a call that we certainly need to do more. There are 4.8 million people living with HIV in the Asia-Pacific region. Many of those countries have had great successes, but many of them are facing considerable challenges, with in fact increasing rates of infections in countries such as Indonesia, Pakistan and the Philippines. In addition, in this part of the world, key affected populations such as men who have sex with men, people who inject drugs, sex workers and transgender people are disproportionately affected by HIV. I also will call for a need to accelerate our investment in science to find a vaccine and a cure. It's only with a vaccine and a cure that we will see an end to HIV. And we'll reflect briefly on the progress we have made and some of the setbacks we have recently faced with the Mississippi baby in our quest towards a cure. And finally, I too, like IU, will call for action, meaning that this time in Melbourne is a great time to talk and discuss and listen, but hope when people return to their homes they will act on what they've learnt in the 5 days here.
Our final speaker for the press conference is the Honourable Michael Kirby. He is a former Justice of the High Court of Australia and one of Australia's foremost jurists and human rights advocates. In addition to his judicial career, he has served the United Nations and the international community in a range of capacities, including as a member of the UNDP's Global Commission on HIV and the Law. Michael Kirby, please.
I have a special reason for feeling a connection with those on MH17. I was at Schiphol Airport in the Netherlands just 3 days before the departure of that plane. I took a different route home, but thinking on them, thinking on that efficient place, thinking on the happiness that existed in the Netherlands because of the wonderful performance of their World Cup team, thinking of the terrible suffering that has been inflicted upon the Netherlands as a country, thinking on my partner, Johan, of 45 years, who is there in the Netherlands, thinking of the chance that exists in all our lives, looking at the names, those friendly Netherlands names, of those who are winging their way to our conference, Job, Pim, Martine, thinking of their families. It is a very painful moment, and it's painful for all of us, and there's no point denying the pain. In the last 2 days since I've been here, I've attended 3 busy working preliminary sessions. One of them was of young people. One of them was of people urging the reform of the law relating to prosecuting infection of HIV, and the other was a session looking at the lessons we have learned from this epidemic and how we must extend them into other areas of healthcare. It's been interesting for me to see how each of those 3 sessions have shared the pain of what we've all gone through, but have been insistent that we should turn this great misfortune into a resolution and a commitment here in Melbourne to advance the program that Michel Sidibé, the Executive Director of UNAIDS, has just outlined, the program to put an end to HIV and AIDS in our world. And in a strange way, the terrible event that has happened has strengthened the resolve of those who are meeting here in Melbourne, Australia, to ensure that we address the ongoing issues of HIV and AIDS and that we bring an end to this fearsome epidemic and learn its lessons and take them into other areas of healthcare. I've been very impressed by the commitment of those sessions that I've attended, and my remarks in the session tonight will be addressed to securing that commitment, getting progress, naming names of those who are not making their contribution, facing up to the realities of our world, that taxpayers in many countries will not keep forking out for countries that are willing to take the contributions for antiretroviral drugs, but are not willing to protect their own citizens by changing their laws and ensuring that we get rid of the laws that make the struggle against HIV difficult or in some countries impossible. And so we go through this period of sadness, but we will come out at the end of this conference with a strengthened resolution to ensure that we put an end to HIV and we take on the lessons to issues such as other communicable diseases like hepatitis B and C, neglected diseases and non-communicable diseases, and the health of everybody and the human right to health, which Eleanor Roosevelt and her colleagues put in the Universal Declaration of Human Rights, that belongs to us all. So that will be the lesson I hope will go forth with the Melbourne Declaration at the end of this week.
Thank you, Michael. I'd now like to take questions from the floor. Please, again, identify yourself, identify your media organization.
Many of you have spoken about the anti-gay laws that are being introduced. What pressure can you put, for instance, the Ugandan Public Health Minister is here today. Have you been able to speak to her about what's been happening in Uganda, or is there something that any of you can do rather than just waiting for governments to reach the conclusion themselves that their laws will cause more HIV?
I had a one-to-one meeting with him because you know that we have a first law, but we have a law also which is just criminalizing the transmission of HIV. After writing to him, discussing with him, he personally told me that he will send back this second law to the Parliament to be revisited, and he is not ready to take action right now. So I think we are trying to have a direct advocacy, but we are trying also to work with people in Uganda, with a civil society group, with also the people who are affected and infected, to make sure that they can be protected and have access to services.
I think it should be said that there's only been one prosecution under the Victorian section, so the Minister told the previous press conference. So it hasn't been much used, but symbolically it was a bad thing. The Global Commission on HIV and the Law of the United Nations Development Programme unanimously put forward a report which called for an end, amongst other things, to discriminatory laws which target passing of the virus and lead to imprisonment and so on, and getting back to an understanding of what laws actually work and what laws don't work. Now, unfortunately, there was great hope that President Museveni of Uganda would not sign the legislation that criminalises homosexuality and makes it impossible to advance even the suggestions of law reform in that direction. There are some heads of government who will talk about these issues. They'll talk and they'll come to conferences, but when the chips are down, they will not take the steps that are necessary. In respect of what's happening in Australia, where we normally muddle through to the right answers, it's wonderful that the announcement was made today by Minister Davis in Victoria, Australia, that they are going to reform their law on this matter. AIDS conferences have the advantage of bringing together people who speak about these things and focus attention on laws that work and laws that fail and impede. And so it's a good thing that that's happened and been announced at our conference. But it's very important that that message should go forth to Africa, to Russia, to the Middle East and other countries where there are laws of this kind. And we shouldn't all be too polite. We should be naming names and being very clear about the fact that the world is not going to put 30 million people on antiretrovirals if the countries where there are very high levels of the epidemic don't take steps to protect themselves. That is the hard reality of the world we live in. That's the hard reality of global economics. And these things, if they're not said during weeks like this, will not be said at all.
Other questions, please?
Thank you so much. My name is Rita from Indonesia. I would like to ask how important is young people like Ayu in the global effort to end AIDS, to zero, and what supports UNAIDS and International AIDS Society for young people like Ayu to move on to end AIDS to zero by the end of 2030? Thank you.
Thank you. In Indonesia, I was part of many organizations, and of course, many young people like me also part of many great work in their country. So what I see is we have some innovative way, and then we have so many fresh idea. That's why sometimes maybe more young people needed in more AIDS program. And the other thing is, I see how we can work together with the government in Indonesia, and the young people's voice are really being heard in Indonesia, because we believe that without young people, I don't know, before you get old, you must be young first. So we will start with ourselves. We don't want to scream so loud, but we will do what we can do today. We will do what we should do. So we're not going to push the government to do something, but the young people in Indonesia especially, and also in the Asia and the Pacific, because I've become from youth lead, where we are proving that we are do something before we ask someone to do it. Maybe that's the point. Thank you.
Francoise, I think you wanted to also respond.
Yeah, regarding the International AIDS Society, one of the priority is to work on infants and adolescents, in particular to organize, like here at the AIDS conference, a kind of forum where people can exchange and identify what are the priority, and then to work together with other partners to respond to the priorities regarding infants and adolescents. You know, adolescence was really a critical issue for the future because the infants that has been treated in the past are becoming adolescent today, and we know that a large proportion of them unfortunately are not retained on treatment, so it's really a critical issue for the IS. And this activity, by the way, is under the responsibility of Linda Becker, who is our next president elected of the IAS. So you can see that this priority will move on.
Thank you. Please, yeah.
Hi, my name is Lata and I'm from Times of India, from India. Basically, my question is about drug resistance cases in, especially ART. We have seen many in India. There are many cases of drug resistance cases. They are taking the anti-ART cases, and they are on second-line drugs. So, can you please elaborate on this? Like, why the drug resistance cases are increasing, and what are the major points? If you can, Sharon, if you can please answer about this.
Drug resistance, in fact, is really rare if people continue to take their treatment. But to continue to take your treatment every day, lifelong, needs significant investment in healthcare systems. It's not an easy deal. Lifelong treatment requires lifelong support, and we know that there are people that drop out of that system along the way. So I think a real approach to manage, in my country, for example, or in my hospital or in my clinic, we almost never see drug resistance. It's rare if people take the tablet. So we have the tools to not see drug resistance. So I think the approach, there's no doubt we do see it in many other countries, but the driver is not taking the tablet. So the approach needs to be around the health system that supports it. Of course, the other issue is that you need to manage drug resistance, which means access to new drugs that are active. Again, I have access to those drugs in high-income countries, and they need to be available in low-income countries too. At the moment, access to those drugs are limited.
That question is also relevant to an extremely important legal question, and that is that as people have drug resistance because perhaps they haven't been taking their drugs, then you have to move up to new and different lines of therapy, and unfortunately, as you have to do that, you run into the problem that new drugs are heavily patented and they are extremely expensive. And that is why the UNDP Global Commission on HIV and the Law suggested that it was an urgent priority of the United Nations to look again at the world's patent law, the intellectual property law, because basically it was formed before 1945, and the Charter of the United Nations, the Universal Declaration, and the great treaties that instill the human right to health. And reconciling that has never basically been done. The right to health and the right of people and corporations to patent protection. Fortunately, that suggestion was followed up by Michel Sidibé, by Helen Clark, the administrator of UNDP, by the then High Commissioner for Human Rights, and a letter was sent to the Secretary General of the United Nations. That letter is being advanced, and Secretary General Ban Ki-moon, who has been wonderful in AIDS issues and sexuality issues, has that on his desk at the moment, and I believe we will see progress in the steps that will set up a new review at the international level to look again at the international patent law, not to take away patents which are necessary for pharma, but to rejig the law so that it is respectful of the universal human right to health. People should not depend on where they had the fortune to be born as to whether they have access to life-saving drugs. And this is a point made in the Melbourne Declaration, and all of us should be signing on to that declaration, and it will give encouragement to this reform of the UNDP Global Commission.
We have time for just one more question, but before that question, just a correction that the candlelight vigil that I referred to at the opening of this press conference will be at 1800 hours AEST, so 6 p.m. on Tuesday, the 22nd. Also, just a point of information that the speech is currently under embargo, will be made available shortly. Last question.
Dean Beck, Joy 94.9. We've spoken about some of the political setbacks, but I'd like you to address some of the scientific setbacks that have been coming forward in the last few weeks in the lead up to AIDS 2014. How is that going to affect the conference and the developments moving forward?
I guess you are thinking about the Mississippi baby. I mean, of course, we are all disappointed, and it's very sad, particularly for the baby, who is not a baby anymore, by the way, who is an infant. She's doing well, by the way, also. She started the antiretroviral treatment again. Of course, it's a little bit disappointing, but we have, for us as scientists, that does not mean that we have to stop at all. That is telling us that the approach that we have to try to detect and measure the cells that carry the virus are not sensitive enough. We need to develop new tests. And this is something that the scientists are already working on it, by the way. That was one of the priorities already defined and published in 2012. And since then, there are several groups of scientists that are working on new tests. It's about the same as for the Boston patient. We already said that for the Boston patient, by the way. The second reason why it's certainly we don't see why we should not continue is because we still have the Visconti patient, by the way. The Visconti patient is now 10 years that they are off treatment. They are still controlling very well their virus and their infection. So studies are ongoing to try to understand how they control. Studies will be done and research will be done to understand why the infants of the Boston patient were controlling only for a while, why it has been only a transient remission. So it's for us, it's novel direction area of research.
Thank you all for your attention, and I'd like to welcome you all to the opening session, which will begin shortly. Thank you.